How's it going? It's Anthony, paramedic intern, class 60. I'm going to be talking about sepsis today. Uh, so, basically, the definition of sepsis is a life threatening organ dysfunction, or it's a dysfunction due to a dysregulated immune response. Basically, it's infection, body has a poor response to it, a not orderly or for whatever reason, which can lead to organ dysfunction. I got a nice little visual right here. So basically, host infection, immune response doesn't act accordingly. Has the potential to become a more severe infection, leading to organ dysfunction. Not all infections will cause sepsis right out the gate, but every infection does have the potential to cause sepsis. Why is sepsis so bad? It just puts a lot of strain on the body. Metabolic demand goes up. You have insufficient circulation. Just by the way, sepsis kind of really affects the body and the immune response to it. Now, the body's natural reaction to any type of infection is inflammation. Inflammation is normal. When it becomes a problem, i.e. in sepsis, is when it starts affecting the circulatory system primarily. You'll have systemic vasodilation due to like excessive levels of nitric oxide. And because you have such systemic vasodilation, your venous return is lower, your systemic vascular resistance is lower, which means you have overall a lower level of mean arterial perfusion. So with poorer perfusion, obviously, it's not good for the body systems, which can lead into septic shock, a type of distributive shock depending on how bad the hypotension gets. And the other problem with that is because the body's not really, because we have such a drop in systemic, you have excess levels of nitric oxide, and a side effect of nitric oxide is it has a reduced effect on contractility of the myocardiocytes, the little guys that can boom boom. Permeability goes up in the vessels, so it becomes like a really leaky system. The red blood cells themselves come like more stiff, so like rigid, so that it's harder for them to transport. So even though an organ can be properly perfusing, it will still not be able to get the right amount of either nutrition, oxygen, because the blood cell just couldn't support or carry the nutrients to it. Bacterial infection is the most common. Staphylococcus pseudomonas, I know you're going to kill me for that, Rick, is the big one along with E. coli, but there can also be viral, fungal, and parasitic. The most common ones that we see in the human body is upper respiratory pneumonia, big one. Thank you, COVID. Abdominal infections, and urinary tract infections, or any type of the urinary system altogether. That's actually a big common one for the elderly is UTI going to full-blown sepsis. Now, sepsis is treated in 6 different ways. They call it the sepsis 6. Jeez. So you give 3 and you take 3. The 3 you take is 2 of them are blood, lactate, and blood cultures, just to try to identify if it's viral, if it's bacterial, just get an idea. And the third is urine output. The 3 we give that we can actually do is, well, -1, antibiotics, broad spectrum, just so you can start treatment, and then you further in because of the blood cultures on the specific bacteria. IV fluids for fluid resuscitation, and supplemental oxygen is actually shown to be pretty beneficial since the body's already having a hard time moving nutrients and carrying them. So a little bit of extra always helps. As for how we treat it in the field, I think we go about the appropriate way of doing it. It'd be nice if we could have broad spectrum antibiotics, but that's a wish. But definitely fluid resuscitation, I would lean more on the oxygen just because if it's already poor perfusion, we're already having that type of issue with the red blood cells, a little bit supplement's never going to go the wrong way. Alright, that's my little quick shebang on sepsis.